This evening or this night we are here at the Eldoret Regional Vaccine Stores to receive the Covid-19 vaccination that we have been waiting, vaccine that we have been waiting for a long period. We are now ready to go because we have received the vaccine, and we have already have our staff trained on administration, storage of the Covid-19 vaccine. We have received 60,000 doses. Eldoret, being the regional vaccine store, has received the 60,000 doses that will cater for Baringo, Elgeyo Marakwet, Nandi, Uasin Gishu, Trans Nzoia, and Turkana. So these vaccines will be collected by the different counties depending on their readiness. And we hope to start dispatching them when the counties are ready. For Uasin Gishu County, we have prepared our Huruma facility that will be providing this vaccination. Huruma will be starting with what has been agreed, the prioritized areas. And the prioritization, the vaccination will begin with the healthcare providers, teachers, and the uniformed forces. We have 3 vaccination centers in Eldoret. We have the Huruma that I have talked about, our Huruma hospital in Tarbo sub-county. We have Moi Teaching and Referral Hospital, and we have Moi Barracks. We have staff trained from the 3 facilities, and once we start rolling out, the vaccines will be provided in the 3 facilities, starting with the priorities that we have just mentioned. And this vaccine is very sensitive to light and stored at a temperature of between +2 to 8. And we have just checked that our cold room here is in the right temperature. We have also checked when we received, you saw our staff checking on different aspects, and I will ask the regional vaccine store manager to tell us what they were checking on the vaccine when you saw they opened the boxes. I'll invite George Water to just talk about what they were checking on the vaccine.
Yeah. How many doses of the 60,000, and does will MTRH also benefit from the same dosage?
We have 15,000 that will go to Huruma, our Huruma facility. We have 3,000 that will go to the RTS, and 6,000 to MTRH. Yes.
They're going to be given to both the public and the private, as they say?
Yes, all healthcare providers from both private and public hospitals, all teachers, and all uniformed forces. Yes.
For that opportunity. As you saw, when the truck arrived here, of course, once the truck was dispatched from Kitengela by His Excellency the President, we were notified of the time that the truck was left the center vaccine stores. So we kept on monitoring, both by phone and also by our remote monitoring devices. Then once the truck arrived in Eldoret, we were able to also confirm the temperatures in transit. That is, the refrigerating unit was checked for the vehicle. It had a temperature of 3.4 degrees. Then also the continuous monitoring devices that were packed alongside the vaccines were also within the recommended temperatures of +2 to 8. Then we were able now to offload the vaccines to be verified on other aspects, including any breakages. We were checking whether we had any breakages so that we can notify the transporter of any damages done to the vaccine. We were also checking the batch numbers because for us, we normally monitor any event following immunization using the various batch numbers of every vaccine that is delivered to this depot. So we were keen on any batches that were dispatched to this place. We normally record them and follow them up to the facility level so that in case of any challenge or any event coming out of that, we are able to track where it actually went. Then after we ascertained that, we were able now to transfer the vaccine very quickly within a span of less than 5 minutes. The vaccines were already in the cold room. So that is just some of the key steps that we normally take, both for routine immunization and also for this new COVID vaccine. Okay. My full name is George Wata Wanambisi. The title is the Regional Vaccine Stores Manager, manning the North Rift region, as well as doubling up for the county expanded program on immunization coordinator for Uasin gishu.